Welcome to Hiroshi Matsuda's Neuroimaging Complete. I will explain why it is possible to obtain brain perfusion images during seizures in epilepsy without being in the SPECT scanner when a tracer is administered. Let's log in. SPECT is very useful in epilepsy surgery for removing an area of the brain where seizures occur. It can capture the increased perfusion in epileptic focus during seizures by comparing it to the interictal period. In this case, increased perfusion is seen in the right temporal lobe. In SPECT, the patient is placed on standby with an intravenous line secured, and the brain perfusion SPECT tracer is injected at seizure onset. After the seizure has ended and the patient has calmed down, the patient lies down on the couch of the SPECT scanner and imaging is performed. Two main radiopharmaceuticals are used in cerebral perfusion SPECT during epileptic seizures, 99M technetium-methylcystionate dimer, ECD, and 99M technetium hexamethylpropylene-anoxime, HMPAO. In adults, approximately 600 megbecquerels are administered. Accumulation in the brain is 5 to 6% of the dose. The kinetics of these radiopharmaceuticals may explain why imaging of SPECT is possible without being in the SPECT scanner. First, let us discuss the ECD. ECD administered into the blood is lyophilic and can freely cross the blood-brain barrier by the blood flow to the brain. In brain tissue, an ester group of ECD is hydrolyzed by enzymes to become hydrophilic. Lyophilic substances can pass through the blood-brain barrier, but hydrophilic substances cannot. However, the enzyme is unable to hydrolyze all of the lyophilic ECD, and some of it diffuses back into the blood through the blood-brain barrier immediately after administration. The hydrophilic metabolites that have undergone hydrolysis are almost unable to pass through the blood-brain barrier back into the blood and accumulate in the brain. This accumulation of tracer transferred by cerebral blood flow is imaged by the SPECT scanner. On the other hand, ECD is hydrolyzed by enzymes also in the blood and becomes hydrophilic. Hydrophilic metabolites in the blood cannot cross the blood-brain barrier. This means that within 1 to 2 minutes of intravenous administration, the blood flow information in the brain is retained for a longer period of time. Thus, imaging can be done after the seizure has subsided. It is also called a snapshot of brain perfusion. For HMPAO, the pharmacokinetics are similar. The only difference between ECD and HMPAO is that the hydrophilic metabolite in the brain of ECD can pass slightly through the blood-brain barrier, whereas that in the brain of HMPAO cannot pass at all. Therefore, if enough radioactivity remains in the brain to allow imaging, it is possible to capture seizures that occurred several hours earlier using HMPAO. ECD's distribution of radioactivity in the brain is stable within 2 to 3 hours after administration, but it should be noted that the distribution changes after about 6 hours. Let's take a look at the time activity curve of the blood concentration of these brain perfusion tracers. The concentration of lyophilic tracer, which can pass the blood-brain barrier, disappears within about 2 minutes in the blood. Let us look at the time activity curve of brain accumulation. The lyophilic brain accumulation disappears within about 2 minutes due to metabolism and back diffusion, and the brain accumulation becomes only hydrophilic metabolites, after which the brain radioactivity remains constant. ECD and HMPAO SPECT can image brain perfusion from approximately 1 minute before to approximately 2 minutes after tracer administration. Thereafter, the images are not affected by the administration of sedatives or other drugs, or if the patient falls asleep. This tracer is suitable for capturing short-term changes in brain perfusion, such as during epileptic seizures, without being in the SPECT scanner. Thank you for watching.